So the next section of this presentation is about identifying drug-seeking behavior in a patient that comes to your office. And just a definition here. So opioid misuse is something that we always want to have on our minds. It's any use of prescription medication that is outside of the manner it was intended for. So we're all well aware that patients can overuse the medication when we prescribe it. They're not using it as prescribed. They may be using it to get high, diversion we talked about, and urine drug screens as a way to kind of identify that. Having multiple providers, and then the concurrent use of alcohol, illicit substances, and non-controlled medications as well. So again, risk factors, these are things that we're looking for in opioid misuse patients, and the two at the top are the most important. So if a patient has a substance use disorder already, and this includes tobacco, that puts them at higher risk for misuse. Also a family history of substance use disorder as well. And you can read these bottom four here. These are also generally considered to be risk factors for developing opioid use disorder and also for overdose potential. Moving forward, ways that we can identify and the management of misuse. So we all have clinical responsibility if we're going to be prescribing controlled substances to monitor our patients. And a universal precautions approach is what is in the literature and what we use to kind of standardize the prescribing and the monitoring framework. It's recommended if you're going to be prescribing narcotics. So this is a list of the universal precautions, and we're going to kind of discuss each one as we go down the list here. So you must document at least each visit. You want a history of substance use and mental health. Those are huge factors for opioid misuse. And then physical exam. So you want to look for evidence of intoxication when they come into your office, oversedation, signs of withdrawal, or any findings that may indicate that they're, using these medications intravenously. So if they have track marks, if their nose looks like they might be snorting it, if they have redness around their nose, septal deviation, stuff like that. We want to document our medical decision making and come up with a plan of care.